Hello and welcome to Spiritual Care 101. We're so glad that you joined us today for this workshop on this important topic. Our course goals are to provide you as a healthcare professional with practical tools that you can use to identify your clients that may be experiencing spiritual distress. And then we want these tools to be customized so that they can be useful to you in your specific workplace. You know, as nurses, we typically encounter our patients, clients, or residents at a point of illness, trauma, or crisis in their life. For instance, if you're a first responder, you're going to most likely be, whether you're an ambulance worker, EMT, whether you're working in an ER, you're going to intersect that client at a point of real crisis, but it's going to be very brief in terms of your total interaction there. In the physical realm, you're stabilizing them and transporting them to additional resources, and so it's going to be much the same in caring for them spiritually. Our responses are going to need to be brief, but just like an EMT can make the difference between life and death for a patient, so can our spiritual interventions make a real difference for that person, even as we are first responding. If you work in a school, a clinic, or a hospital setting, you have a much broader continuum of opportunities to interact with clients. It may be a one-time visit to that clinic, or that person may come regularly, either for health maintenance or for ongoing wellness interventions, chemotherapy, whatever. So we may have a one-time intervention, or we may see that person regularly. If you have the opportunity to work in a long-term care setting, of course your interactions with those clients are daily and ongoing. In today's healthcare arena, with an increasing focus on healthy lifestyle choices, there's a great emphasis on providing holistic care. And of course, that is caring for the whole person, body, mind, and spirit, with a focus on empowering that individual to make good and wise lifestyle choices for themselves and their loved ones, and then equipping them with the tools that they need to have a successful life as they define success. So our focus in providing spiritual care is going to be, much as it is in physical care, we want to empower the individual to identify their own spiritual needs, and then we want to equip them with the tools and the resources they need to meet those needs. For many years, healthcare was delivered through using a medical model, and that model focused on either curing illness or repairing injury. And so the focus was almost totally on fixing that person and making them better. And yet, holistic care has been around for a lot longer than we think. So consider this quote from Florence Nightingale. She was a woman born in 1820. She lived until 1910, so 90 years of productive living. She was considered a pioneer in nursing, in mathematics, and also in statistical research as applied to nursing care. But listen to this quote. She was more than a mathematician, more than an excellent clinician. She says, "It is difficult to imagine a successful nurse who disdains the necessity for some form of spiritual faith in her own life. It is indeed a pitiful situation if one is hungering for spiritual consolation and there is no one to help in the last moments but a scientifically trained nurse who has forgotten that she has ever been introduced to God at her mother's knee." So, great nursing has always dealt with the whole person. Our course objectives as we go through this course, we hope as a participant, once you're done, you'll be able to differentiate between religion and spirituality. You'll be able to define spiritual distress and identify the signs and symptoms of spiritual distress. You'll be able to explore cultural values and life events that may be predisposing factors. We also hope that you will be able to define the role of unforgiveness in spiritual distress, that you can identify common misperceptions of forgiveness and unforgiveness and how they may trip your client up on their way to spiritual wholeness. We want to define the ditches of spiritual care and stay out of them. You know, anytime we approach a topic such as spirituality, there are a lot of different opinions. There are a lot of different very strong feelings that people have, and yet there is a way to navigate providing spiritual care without offending the individual, and so we want to define those ditches and learn how to avoid them. And then we want to be able to incorporate specific spiritual care interventions into the care that we provide for our residents. So as we get started today on these objectives, we want to take a moment and define our terms. You know, in any avenue of life, whether it's medicine, whether it's technology, whether you're in the military or in sales, each area of life has its own language, and we want to take just a minute and make sure that by identifying our terms very narrowly here, we are speaking the same language today. Religion at its basic is an outward expression of an inward reality. Hopefully. And there are thousands of different organized religions in the world, and so our point is not to be an expert at each, but to understand how religion impacts the clients that we serve. So let's look at a few things that religion is. First of all, religion, whether it's Christianity, whether it's Buddhism, whether it's Islam, it is a system that has developed over time, and typically a long period of time. Most of the major faiths of the world have a body of literature that defines who they are and who God is. For the Christian, that would be the Bible. For someone of the Islamic faith, that would be the Quran and the Hadith. For a Jewish believer, would be the Old Testament, the Torah, the Psalms, and the prophets. For someone in the Eastern religions, there might be the Rig Veda or other bodies of literature, but organized religions have a body of literature that helps them navigate spiritual issues. Most of the major religions have prescribed rituals both for worship. Is it song? Is it instrument? Is it dance? Is it drums? Is it silent? They also have prescribed rituals for major life events such as birth, coming of age ceremonies, marriage, baptism, and rituals for illness and approaching death. And then these major religions are utilized by a group of individuals. So there is a community of faith that ascribes to most of these components of their religion. Now, it's possible to be a religion of one, but for our purposes today, this is what we are going to describe as that term religion. So now let's look at what spirituality is. In many areas, spirituality and religion may overlap, but they may not. So spirituality may or may not involve formal religious practices. I'm sure all of us know friends or significant others that maybe rarely, if ever, go to a place of worship, and yet they are very wise and deeply spiritual people. So may or may not involve formal religious practices. Spirituality may include all of the below, but it's much more than just something that makes me feel good. It is a life philosophy in that how we see ourselves spiritually guides our way through life, but it is much more than that. It is looking within in both organized religion and unorganized, if you will. There's a place for introspection and for contemplation. I don't know about you all, but sometimes when I look within, all I see is a big mess. So looking within is certainly a part of, but it's not the only thing that has to do with spirituality. So let's talk about some other things that spirituality may or may not include, and then we'll go ahead and define the term very specifically. Often when I've gone to spiritual care workshops for my nursing, continuing ed and such, what I actually find after being in those workshops for a little while is that they're actually dealing more with what we would call the soul, or a psychologist might call the psychosocial elements of our life. We all come with a body, and then we also have that those intangibles of our personality and our intelligence. So our mind helps us think and reason and interact in the world. Our will, another word for that might be our chooser. As we approach major life events, we have choices to make, and every day we make hundreds, if not thousands, of choices, large and small. And then we also deal with the realm of emotions, and we know that the psychosocial elements of mind, will, and emotion impact our physical body. And likewise, if our body is ill or injured, or we're struggling with a recent diagnosis or chronic illness, this definitely affects our emotional well-being. So all of these are a part of who we are as a spiritual being, but they're not exactly the whole ball of wax. And so we'll talk about that more in just a minute. Stop and think for a moment. There's a progression when we meet someone for the first time. First of all, we have that physical interaction. We see them with their eyes, we hear their voices, and perhaps we shake their hands. Then as that relationship continues, our mind thinks some thoughts about them. Well, I like that person. I'd like to spend more time with that person. And so our will kicks in, and we begin to figure out ways to spend more time with that individual. We think of questions to ask them with our mind. And then as we develop a closer and closer friendship, or maybe it's a love relationship, boy, then those emotions really kick in too, and we think, oh, I love this person. Or perhaps we think, oh, I really don't like them as much as I thought. I think it's time to bow out. And so whatever the emotion is, whatever the thoughts are, we begin to interact with them on a deeper level at that psychosocial level. But have you ever had a very, very dear friend? I hope all of you have. And you know that you can move across country or around the world. You can have very limited physical interaction with that friend, and yet there's something about that friendship that has knit your hearts together. And what might we even say, what's an expression that we use about a dear, dear friend? We sometimes will say, well, he and I, or she and I, are kindred spirits, don't we? There's some deeper level besides just deciding to like them, deciding to choose to spend time with them, thinking happy thoughts about them. Somehow our hearts have connected at a deeper level. And so it is there that we interact with them as a spiritual being. This concept is important to keep in mind too when we are caring for someone who's unconscious. Physically, we may be doing a lot of care for them. We may be making choices on what interventions they need. We may even feel strong emotion as we care for them, but that interaction is pretty much one-sided, isn't it? Because they can't physically communicate with us. Yet many times we find ourselves being deeply impacted in our spirit or our heart by that unconscious person that we care for. So we've talked about some of the things that spiritual care is not. Let's look at some of the traditional nursing definitions of spiritual distress, and also just of spirituality as a whole. So this quote says, that all people have a spiritual dimension, whether or not they participate in formal religious practices. This tells us that that patient that we're caring for that may be an atheist may still have spiritual needs, does in fact still have spiritual needs, and they may have chosen not to believe in God or in a higher power. They may have decided that that is not a part of their life, and yet this quote tells us that they are still a spiritual being that may be in spiritual distress and have needs that we can help them and assist them with. This quote says that an individual is a spiritual person even when disoriented, confused, emotionally ill, irrational, or cognitively impaired. This means that that person with Alzheimer's who cannot remember their name anymore, who doesn't recognize their loved ones. This means that that person with who is in the depths of depression or profound mental illness, out of touch with reality, the person who has many developmental disabilities and is profoundly cognitively impaired, all of these people are still at the core a spiritual individual. This is a powerful statement. It points to the worth of the individual no matter what the condition of their earth suit, no matter what their cognitive ability is. It says that this is a person of value and worth simply because they are here. So, what is spirituality then? If religion is primarily a system, spirituality is primarily a relationship. And it is a relationship that can involve two strands. There's the vertical strand, which is between the individual and their God. And then there is also the horizontal strand between that individual and significant people in their lives. So as we mentioned before, some people may choose not to engage in that vertical strand. For them, spirituality is all about the relationships with people around them. I'm sure we all know of people in our lives that really like that vertical strand. They're all about a relationship with God, but they may not be much fun to be around. So perhaps they could use a little assistance on that horizontal relationship as well. But like any good relationship, it is freely entered into by both parties. It would not be much of a friendship with God or with a friend, a neighbor, or a relative if I just marched up to them and said, "Hi, I'm Carol, and you're really going to like me. We're going to be best friends starting now." What might that person's response be? They might say, talk to the hand. I'm out of here. No, a relationship is something that is sought out by both parties. The hallmark of a good relationship is that both parties are interested in developing that relationship and nurturing it. So it is also one aspect of spirituality that is different than just religion or just that psychosocial arena, is that spirituality is also eternal or timeless. At some point in time, those that we dearly love and care about are going to die, or they're going to become, very ill, not be able to communicate with us, and then they may pass away. Think of individuals that have made an extreme, wonderful impact in your life, and perhaps that person is dead now. And yet, is their impact any less powerful in your life? No, it's not. They may have been dead for decades, and yet the things you learned from them are just as real and just as powerful today as they were 50 years ago. So there is a timeless or an eternal aspect to spirituality. The same can be said for someone who hurt and betrayed us. They may have been dead for a number of years, and yet the damage that they've done continues to impact our lives today. So, for that person for whom their religious life is important, their faith, their relationship with God is important, they will understand that God is an eternal being. And so there is then this timeless aspect, whether it's vertical or horizontal. So very, very simply, a very simple working definition of spirituality is a timeless relationship to God and or those around us. So spirituality is more than just a line on an admission database. When we admit someone to a clinic or a hospital or long-term care facility, often there's a space for what is your religious preference? Would you like a member of your faith community to visit you? Spirituality includes that, but for that person that doesn't have a faith community, it may not include that, and yet it's very important. Spirituality is the connecting of a friendship, one heart to another, human to human, one heart to another, human to God. That need to connect is hardwired into who we are as human beings. And then it is also a relationship that time cannot erase. So in a nutshell, religion is a system for how we approach our spiritual life. A person may or may not be a part of an organized religious system, but spirituality is a relationship. So then, let's move on and begin to define our terms further as we look at some definitions of spiritual distress. One definition is that it is a disturbance in the areas of human existence which are commonly associated with spirituality, such as the meaning of life, who am I, what is my destiny, forgiveness, relationship to a higher power, etc. Another definition is the state in which the individual or the group experiences or is at risk of experiencing a disturbance in the belief or value system, which provides strength, hope, and meaning to life. So this tells us that it is possible for a group to experience spiritual distress as well as an individual. And you know this to be true if you're a first responder and you're responding to a 911 call in someone's home. You are dealing with distraught and upset family members and friends as well as that individual. And we see that in the hospital and long-term care setting as well, as our clients struggle with issues that are deeply affecting them. This spiritual distress can widen itself into the larger community as well. Think of incidents recently in our metropolitan area where there has been sudden loss of life due to school shooting or horrific accidents in which several people are killed. It impacts the whole community. So it can be an individual distress or it can be a group that is experiencing that distress. Here is another definition. It is distress of the human spirit, a disruption in the life principle which impacts a person's entire being and which integrates and transcends one's biological and psychosocial nature. Well, this is a real mouthful, but at its simplest, that life principle, who that person is spiritually, as we said before, it's more than who they are biologically. It's more than who they are emotionally and socially. And if they are in spiritual distress, all of these arenas of their life may be affected. So to summarize, spiritual distress is any disturbance in spiritual relationships, whether it's that person's relationship to God or whether it's their relationship with individuals that are important to them. It may be separation from their religious support system, and it results in distress of the human spirit. So what does spiritual distress look like? As we take time to assess our client, here are some subjective observations that we may hear our client saying. We may see them questioning the meaning of suffering. They may ask questions like, how could this happen to me or to my loved one? How could God allow this to happen? Why do good things happen to bad people? They may ask for spiritual counseling or assistance. They may just say, I'm a wreck. I really wish I could talk to my pastor or my chaplain. We may hear them have a stated crisis of their value of belief system. Now, typically a client will not look at you and say, I'm having a crisis in my belief system. But what we may hear them say that gives us a clue that this is happening is they may say, you know what, I've been to synagogue every Saturday since I was a little boy, or I've prayed 5 times a day since I can remember, or I've been to Mass every Sunday. This religion thing just doesn't work. I'm done with it. This is a person who is experiencing spiritual distress. Oftentimes, what we may find is the person may have been involved in a religious community for many years, and yet they know all the forms and the rituals and the words, and yet that relationship with God has not been developed. It's a little bit like a Walmart truck driving down the road. That trailer represents their religious system. But what happens when the trailer is in an accident and the doors fly off the handles? What is inside that trailer will make the difference for them spiritually. Is there a relationship with a living God who loves them? Are there relationships with significant others around them who can support and strengthen them? Or is that trailer full of books and icons and the junk and stuff of life, but empty of relationship? What are some other things that we may hear our clients say? They may express a concern with the meaning of life or death. I often tell my CNA students that it's important as caregivers that we think about these things as well, because however long we live, we're going to be dead a whole lot longer than that. And so these questions are worth our wrestling with now. That client may voice a fear of dying. Sometimes it's just the fear of the process itself. Is it going to hurt? Am I going to be alone? Will there be anyone with me? What's it going to be like? None of us knows. But sometimes there's a fear of what will happen to me at the moment that I die. And this is a very real fear for many people. We may hear them voice anger at God or have questions about God. We may hear them say things like, is God good? Can he help? Does he even want to? Do I matter? And we want to help our clients that are wrestling with these issues see that he is good. He can help. He does want to. But we are free, and they are free, to pursue those answers or not. The choice is up to them. But the healing process actually begins with voicing these feelings, voicing these fears, voicing these angers and these challenging questions. Other things that are a little tougher to pick up on is this client may express just a nonspecific guilt. They may have a sense of dread or anxiety about their life all the time. It's just a vague uneasiness that things may be okay today, but the shoe is about to drop. We may also hear them voice frustration with themselves and their inability to meet their high expectations that they have for themselves or for others. We may notice, and they may report, that things that used to bring them a great deal of pleasure and satisfaction just have lost all of their appeal, and that even relationships, pleasure in their work, none of these things are enough to shake that sense of gray that gray cloud that just hovers over their lives. Or we may hear them express doubt as to their own value and their own worth. They may say things like, is this all there is? I've been working all these years, I've been doing all this, and is this all there is to life? And again, often a crisis in their life will bring a person to a screeching halt long enough to ask these questions. We oftentimes in long-term care settings hear older adults say things like, I don't want to be a burden to anyone, or I'm just a burden. I wish I were dead. Everyone would be better off if I were dead. These are all subjective statements of individuals who are experiencing spiritual distress. So what might we see objectively? What observations can we make that give us some clues as to where our client is spiritually? Sometimes we may see indicators in their room or in talking with them that their faith is important to them. We may see religious articles. We may see them take time for prayer or be reading a prayer book. They may be reading spiritual literature, a Bible, the Quran, devotionals, other things that give them comfort and hope. We may see them visiting a place of religious worship. Maybe they're a hospital patient and they take time to slip down to the chapel. So these are clues that we may see that spiritual life is important to our resident. Other things that we may see in terms of objective signs and symptoms, they may ask. We may see that they've experienced a recent traumatic event. Now that doesn't automatically mean that they're in spiritual distress, but it should cause us to have our antenna up a little more and be alert for other signs and symptoms that they may be struggling. Or it could be a recent, maybe they have an upcoming diagnostic procedure or surgical procedure that they're very concerned about. Again, not necessarily something that will cause them distress, but we need to be alert for signs that they might be fearful or worried about that. From time to time, there are identified conflicts between medical treatment and their religious beliefs, such as blood transfusions, dietary restrictions. For many of the major faiths of the world, fasting on regular intervals or on holy days is an important component of faith, yet that may not be really healthy for that diabetic resident to do that, or that diabetic client. So there may be times that there's a conflict between what is physically appropriate for them and yet what is important to them spiritually. Some other things that we may see: changes in their body language, increased restlessness, tears, changes in their appetite, in their sleep patterns, in their pain management or pain control. We may see increased call light usage and reluctance to be alone. We want to look at the whole person and what is going on with them, so we don't want to just pull out one of these objective observations and say, oh, they must surely be in spiritual distress. They aren't sleeping well. Maybe they're in pain. Again, we are a package deal. Spirit, soul, and body, one system definitely impacts the other. So we always want to be sure that we are looking at the whole person. I remember one time in working at a major hospital on a med-surg floor one Saturday night, we had an elderly woman who was admitted with a severe exacerbation of COPD. She was in her 80s. On the religious database, she indicated that she wanted to see a chaplain, and she was in very, very bad shape. And so it was, we were in her room very often trying to get her stabilized. Unfortunately, the only room that was left was a room down at the end of the hall. And as often as we were in the room, as soon as we left, that call light went back on, and it was just almost a continuous thing. And as her physical condition stabilized, there was no let up in that call light usage. And finally, I sat down with her, and we'll call her Mrs. Smith. And I said, Mrs. Smith, you seem to be just very apprehensive. talk to me about that. Tell me what's going on. And she said, oh, honey, I've been a church going woman all my life, but I am just so afraid. And I asked her, I said, would it be all right with you if we prayed and asked God to calm your fears? And she said, oh, I would love to do that. And we did. It was a very simple 2 or 3 minute interaction, and almost immediately after that, she began to settle down, fall into a good and restful sleep as her condition continued to stabilize throughout the night. So we want to be aware of these signs and symptoms. Others that we may see, obviously, if they've had a huge traumatic episode in their life recently, that is going to be a huge red flag for us. If they are coming into the clinic often with just an increase in sick days, trouble just dragging themselves out of bed to get into work, again, this can be just a sign that they are burned out and exhausted with life. We may see a person who has difficulty controlling verbal outbursts and blame. We may see someone whose facial expressions are just non-existent. In other words, they have lost that spark and that zeal for living. Obviously, there are other physical and emotional things that can cause that, but if this is a change, again, we want to be aware that there may be a spiritual component to it as well. Lack of eye contact, sometimes this may be a cultural thing, but if this person has normally been vivacious, outgoing, looking us in the eyes, and now it just seems like all of the light and joy has gone out of their eyes, we need to be thinking about what may be going on with them spiritually. Maybe they have been pretty good about caring for themselves, and all of a sudden they just don't care anymore. We know that spiritual and emotional events have a definite impact on our physical body. There are all kinds of research studies out there from Harvard, Yale, Duke, well-recognized universities that correlate a person's spiritual well-being with their physical well-being, and that's a study for another time. They may complain of sustained fatigue and exhaustion. And in this instance, we might want to ask them some questions about what their day looks like. Is their day so full of activity and doing for others that there is no margin left for them at all? If that's the case, why? And what suggestions can we make to them? What can we do about it? Think about your own workplace environment for just a moment. Take a second and jot down additional indicators that now that we've talked about it for a little bit, you're thinking, oh, maybe this person was in spiritual distress and I just didn't realize it. So what other signs and symptoms have you seen? There are other factors impacting our spiritual well-being and that of our clients. For many of your clients, especially if they're 50 years old or older, they have lived through a historical loss of moorings or loss of foundations, for lack of a better word. There have been many, many changes in our culture over the last 50, 60, 70 years. 80 years ago, a person born into a family might have most of their family living nearby them for most of their life. But with the advent of the two-parent workplace environment, our jobs often take us far from our families, and so there have been changes in family structure and in the location of our extended family. They're no longer right down the street or right around the corner, and many times they're not even in the same city. Even within our communities, our neighborhoods, there has been a gradual increase in isolation within our communities. When I was a little girl 50 years ago, if I fell down and skinned my knee, every neighbor in the neighborhood knew who I was, knew my name, could come out and help me, and I knew that they would help me. Nowadays, oftentimes we hit our garage door opener, we zip in and out of our garages and our homes without ever interacting interacting or meeting the people who live right next door to us. And then there have been dramatic changes in who it is that gives us our foundation and who gives us our moorings in life. For younger adults, the Generation X, Generation Y, and beyond, for these individuals, oftentimes they get their relevance, their identity, and their value from what they see in the media. They get that identity and the support from their age peers, who may be very tenderhearted and very supportive, but they may not have a lot of life experience to draw on, or their advice may not be the healthiest or the wisest. And of course, there's a huge explosion in the last 5 or 10 years or so of virtual relationships where we are interacting online, but increasingly rarely face to face with a human being, where we can read their facial expression, read their tone of voice, and know that they care for us. So there is a continuous bombardment of media, of virtual relationships, as our real life, actual human being communities tend to be very, very impacted by this. As we think a little bit more about these cultural values, stop and think for a minute of TV programs and movies that you like to watch, or that your clients like to watch. Who are the stars? What do they look like? Oftentimes, whether male or female, they look amazingly fantastic. They all look the same. They're all fit. They've got great hair. They've got white teeth. They are successful in their jobs. They drive fast cars. And do our lives look like that? Do our clients' lives look like that? At the point that we meet them, at the point of trauma, illness, or other life-changing event, their lives are in stark contrast to what they see in the media. This quote by Henry Nouwen says it very well. The elderly do not offer the professional who is primarily concerned with cure much chance of satisfaction. They confront the doctor with the limitation of their healing powers, the psychologist with reality of self-fulfillment, the social worker with the lasting ambiguities of human relations, and the minister with the undeniable reality of death. In short, they confront all who live with the illusion of any final cure. But it is exactly this confrontation that opens the way for a constant reawakening of our primary call, which is not so much to cure, but to care. The clients that you interact with regularly, think about the populations that you serve. What life events can you identify that may predispose them to spiritual distress, trauma, grief, loss? Let's talk for a moment about unforgiveness and the role that it plays in spiritual distress. Unforgiveness taints all of life, just like a poison. For the person of faith, unforgiveness will taint not only the person that they are angry and unforgiving toward, but it will poison their relationship with God. For the person for whom spirituality is mainly those people relationships, unforgiveness the poison doesn't confine itself to the person they have not forgiven, but it will eventually poison all of their relationships. It is a very potent poison. Unforgiveness has been likened to drinking poison and expecting the other person to die. Some common misperceptions about forgiveness. We've all heard the phrase, probably, forgive and forget. Yet we are not wired to forget. Unless we have a traumatic brain injury or something, we are not going to forget the person who has injured us or hurt us. We've heard it said, time heals all wounds. Not necessarily. It's time that's spent purposefully healing those wounds, but time alone will not close a wound of the heart. Sticks and stones may break my bones, but words will never hurt me. Sometimes words can be the most damaging to the spirit, more so even than physical abuse. Sometimes the person will tend to minimize. Oh, it wasn't that big a deal. I mean, my dad was never there, but after all, he never beat me. If it matters to that person, if it caused a loss in that client's life, then it's important. Related to that, we may hear that client comparing their life with someone else's and saying, well, I really have nothing to complain about. Again, if it matters to them, it matters to God and it matters to us. Perhaps the person that hurt and wounded them is dead. And so that person said, well, it's too late. Forgiveness is primarily an exchange between our client and God. So even if that perpetrator has been dead for many years, it's never too late. Oftentimes you'll hear the person make excuses for the person that wronged them. Well, they were doing the best they could. After all, they were abused as a child as well. That may very well be true. Here's a freebie that is very, very helpful, and this thought is more than one thing can be true at the same time. That person may have been abused themselves. They may have been doing the best they knew how. But if they injured and hurt your client, they were still wrong. Oftentimes, the person is afraid that if they forgive, then it's an admission that what was done to them was really no big deal and that it's okay. Nothing could be further than the truth. Other times, that person may be afraid, well, if I forgive, then I have to trust them again. Nothing could be further than the truth. Forgiveness is given, but trust is earned. It may not be wise to trust that person again. It may not be wise to be in relationship with them again. But that is not the same as forgiveness. So let's define forgiveness very simply and quickly. In a nutshell, forgiveness is pay me what you owe me. And what that person that wronged or offended our client may owe them may be as simple as an apology. It may be as simple as respect. It may be restitution. Maybe your client was slandered and their reputation was ruined, and they want that individual to make it right publicly, restore their good name. Maybe what that client is owed is commitment. They've been diagnosed with a major illness and their significant other just walks out on them, and they feel like they're owed that commitment. And we would agree with them. They are, but it hasn't happened. Maybe what is owed them is a lost childhood. Due to abuse, due to having to assume adult responsibilities sooner than they otherwise would have. And what kind of value or price can we put on things like that? So whatever the debt is, unforgiveness is simply expecting that person to repay the debt. So let's talk about what forgiveness is. It is not just a feeling, although a person may experience a real sense of freedom and joy with the process of forgiving, but they may have no feelings at all. So it goes beyond a feeling, but it is a conscious decision to take a cold, hard look at what they have lost and to decide to cancel that debt. It does not mean that debt won't be repaid, but that individual, that client, is choosing to cancel the debt as far as it concerns them. That client, in forgiving that individual, chooses to take them off of the hook of their unforgiveness. And a real sense, forgiveness is actually unlocking your cell door, unlocking your client's cell door so that they can go free. The road to providing spiritual care is sometimes tricky to navigate. It may be wild and uncharted, but the view is spectacular, and the effort, the journey, is well worth the while. So on the road to spiritual care, there are a couple of ditches that we want to avoid. And the first ditch is simply avoiding the issue. You know, religion and politics are two things in our culture that we tend to not talk about, sometimes even with our closest family members or friends. But when a client is in spiritual distress, we do them a great disservice by avoiding the issue. The other ditch, the opposite side of that, is being too aggressive in our providing our spiritual care. Even if our own faith is strong and certain, we must not force our relationship with God or our understanding of spiritual things on someone else, but Travel the road with them. Explore that road together. There are also a few potholes that we want to steer clear of. Things like minimizing. When a person is hurting spiritually, the last thing they want to hear is, cheer up, look how much you have to be grateful for. Just kind of makes you want to smack the person that's saying that. Again, more than one thing can be true. They may have many blessings to be grateful for, but if we start there, the conversation is apt to be very short and it could be unpleasant. We also want to steer clear of cliches. I know just how you feel. Oh, don't worry, everything will be all right. Or in the loss of a loved one that's precious to them, oh, don't worry, they're in a better place. Again, all of these things may not be true, but we don't want to stop there. The other pothole that as caregivers we tend to step into fairly regularly is having to have the perfect answer or having to get this issue resolved like right now. Is diabetes resolved like right now? No, it's an ongoing process. Is cardiac rehab resolved right now? No, it's a process. And so, can we be content to be a link in the person's chain of their own spiritual growth? So if we keep in mind the ditches and the potholes, remember our long-term goal. We want to increase their spiritual wholeness on their terms, on their timetable, give them the tools and resources they need to meet their own spiritual needs. We want to keep the client in the driver's seat, and we want to stay on the road. So, with that being said, let's go ahead and look at some of the tools that we have to put in your toolbox today as you seek to provide great spiritual care for your residents. You know, a lot of times we think, what is it that I have to give? And listening is one of the most powerful tools that we have to offer that individual. So let's talk a little bit about some tools for listening. First of all, you want to try and schedule your time with that client to minimize interruptions. So in the middle of a busy day at the hospital, if you hear a client say some of these spiritually distressing subjective statements, or you notice that they seem apprehensive or clingy, maybe your day is too busy to do anything about it right then. It might be helpful to say to that client, you know what? I can tell this issue matters to you a great deal. How about if I stop by at 2:30 and let's really spend some time talking about this? So find a time that is convenient for you where you can give it your full attention, and that client will know, even while they're waiting, that they are being helped and cared for. Let's focus on the substance of what the individual is sharing, not necessarily their presentation. Sometimes when people are in spiritual distress, they're very angry, they lash out, they may be even verbally abusive, but try to get behind the presentation, even if it's presented in an ugly fashion, and get to the meat of what it is that's on their mind and heart. And with that, see if we can identify key themes as the person shares. We may want to clarify or paraphrase to make sure that we're understanding them. So after they've shared for a little bit, we may say something like, so if I understand what you're saying, you're really concerned about this upcoming test, or what the prognosis is for your treatment. So we'll paraphrase. We want to be aware of body language, theirs and ours. It doesn't take any longer to pull up a chair and sit down eye to eye level with that person than it does to stand and listen to them, and yet it makes a world of difference in communicating active caring to them. Here's one that's tough for many of us, especially when we are looked to have answers for physical needs, social needs, emotional needs, the whole idea of silence. Silence is your friend. A lot of times, if we just pause and don't jump right in with an answer, the client will have time to mull things over and dive in with another question, another observation, another fear, another response. So remember, silence is your friend. Explore what you don't understand. Could you tell me more about how this has impacted you? Or what do you mean exactly when you say that? Fill in the blanks. So explore or seek clarification for what you don't understand. Recap what you do understand. And then look for the emotions behind the statement. This can be very important, especially when you're dealing with someone who is aphasic or who is out of touch with reality or who is struggling with dementia. My own mother had about a 7-year battle with Alzheimer's. And during that time, she also had a small stroke. Sometimes the words would come very clearly, and other times, as she was trying to pull words out, they would just be gibberish and just nonsense syllables that I couldn't understand. To make matters worse, she was halfway across the country, she and her husband, and so I didn't have the advantage of being able to read her body language, her facial expression, and so that was a real challenge for me. But one day it was her grandson's birthday. The day came and went, and there wasn't a phone call from mom, there wasn't a card or a gift, and my mom was born to be a grandmother, and so I knew that something was seriously wrong. This was kind of in the early stages of her disease process. So uh, hindsight being what it is, I maybe would have never made this observation on the phone, but I thought to myself, I'm going to make my mom feel better. I'll tell her what a great party we had for Sam. So I described the cake, the presents, who was there, and all of a sudden over that phone, I could hear a great sadness in my mom's voice as she said, "Oh, Carol, I'm just no good. I'm a nothing, nothing, nothing for nobody, body. I don't have no foodoo, or feedy. And I was thinking to myself, dear God, what is she trying to say? And how do I respond to that? I could tell that she was deeply upset that she had forgotten her grandson's birthday. And so that was what I responded to. And I just said, Mom, the boys are so lucky and blessed to have you as their grandma. You are the best mom in the world, and you are the best grandma, and they know that you love them. There was a silence on the phone. And then it was almost as if I could hear my mom pulling herself up to her full 5'1" height. And with great pride in her voice, she said, Carol, I am going to put that in the heart of my downtown. And when she goes to bed tonight, won't she be proud? And then she laughed and laughed and laughed. And through my tears, I laughed and laughed and laughed as well. And by being able to respond to that emotion that day, that was perhaps the last entire conversation I ever had with my mom. But I knew even as she lost her voice, as she lost her awareness of who I was, I knew that somewhere in that body was a woman who loved me, and I knew that no matter what happened, I was in the heart of her downtown. So oftentimes we may think, what do I have to give? And, I'm not a chaplain, I'm not a minister, I'm not a rabbi, but the rarest gift of all is the present of your presence. So we've talked about some ideas when it comes to listening, to interacting with that person. Let's talk about just some specific communication skills. Life is all about relationship, and communication really is the lifeblood of relationship. So some simple things that I've found effective over time is to say what you see. We may say, I noticed that you haven't been down to the chapel services this week. You used to really enjoy going all the time. Or we may say, you don't seem yourself today. Or you seem sad today. Sometimes just that statement is enough to begin to open the door for that person to begin to share spiritual concerns that they have. We may, along with that, utilize the avenue of door opening questions. Think of these as questions that can't be answered with just a yes or no or a fine. How are you doing today? What do we all say? We say fine. So when I utilize door opening questions, I want to think about wording that question in such a way that it can't be answered just yes or no. So it may be, and then what happened? And so what did you do next? What were your thoughts about that? Who all was involved? How did they act? Another kind of a sister to door opening questions can be just asking that person to tell you their story. Maybe it's Christmas time and you might say, what was a favorite Christmas experience as a child? Or what was the most unexpected Christmas you ever had? You'll get them to tell you. If they were a musician, what was the best gig you ever did? What made it great? Where would if a traveling someone who travels a lot for their job, where's your favorite city? Why is it? Where would you never want to go again? Why is that? As we take time to ask questions about the mundane and ordinary things of life, we are building relational bridges that establish that we are safe individuals to trust with the bigger questions of life. Almost as rare as the statement, "You were right," or "I could have been wrong," is the statement, "Tell me more." It is so rare that someone will push the pause button, sit down with a client and say, "I want to hear more about that. How were you affected? What did you think? So tell me more." 3 words that are pure gold. Then another thing that we can think of as we're communicating with that client is what thoughts are we hearing them express, and is that thought their friend? Sometimes, again, more than one thing can be true, but I've found in my own spiritual walk that often the thoughts that torment me the most, if I stop and write that thought down, and I'll even take a piece of paper and make 2 or 3 columns, and one column is what is the thought, and then because my faith is important to me, my next column might be what does God have to say about that thought, and then my third column is what is the truth. For the person who chooses not to have a relationship with God, maybe they're going to have 2 columns. What is the thought? And what is the truth? The thought may be, everybody hates me, or I'm no good. Is that thought their friend? What is the truth? Does everybody really hate them? Of course not. A lot of times just identifying that thought, putting it in writing, and putting the truth right next to it is enough to bring a measure of spiritual comfort to that individual. For the client of a specific religious faith, we can also build on the strengths that faith offers them. We want to provide privacy and quiet that they need for their spiritual maintenance, whether it's prayer, contemplation, reading, listening to music, and perhaps that person needs assistance with that. Maybe that elderly person needs assistance to kneel and pray, or to put the rosary beads in their hands. So we'll offer assistance as needed. Of course, we always want to treat religious articles and beliefs and rituals with respect, and we want to be an advocate for that client within the interdisciplinary team. For the person of faith, we want to inform them of any additional resources that are available, such as TV or radio programs that they might enjoy, books, devotional guides, literature, and services that our hospital or our nursing home may provide. Perhaps there's a meditation room and services that they would like to go to. For that person of faith, as they're reading their scriptures, I may ask them, what is a favorite verse, and what does it mean to you? We we may find that as we encourage them to express their faith, that it actually strengthens their faith. Let's talk about a few minutes the power of ritual in spiritual care. For the person with a religious background, become a student of that client. Learn what rituals are meaningful or bring comfort and hope to them. Maybe it's communion. Maybe it's praying at set times during the day. Maybe it's specific holy day observances or fasting. And then be a bridge. Are there others within their faith community who need to be a part of their disciplinary team? Let's call them. Let's make those connections with our client's permission, of course, because they always need to be in the driver's seat. For the client with no religious background, but who is asking those spiritual questions, let's encourage them to be an explorer. They may be able to create their own rituals. Perhaps it's music that they enjoy, special meals together. I once read a book by an author, James Haller, who was a dietitian in hospice. And one lady who was dying of cancer she was an old curmudgeon, cranky, cross, and of course in pain and no family around. And he began to bring a little medicine cup of ice cream every day, and the two of them sat and had a bite or two of ice cream together every day, and it became a holy point in her day, and her dying words were how much that little ritual meant to her. We may encourage our client to journal their prayers, journal their thoughts, their questions. We may encourage them to consider contemplative prayer, just being still and thinking about God. Perhaps it's being outside and being in nature. And we can be a bridge here too. Are there other members of the interdisciplinary team or their family who might be involved? Again, with that client's permission. Maybe it's a chaplain, maybe it's an activity director, or someone out in the community. Remember that horizontal aspect of spirituality. Who is already in your client's sphere of influence? Who is already important to them? These are people that we want to draw into their spiritual care, if at all possible. And then how can we create additional connections with and for them? My mom, as she was admitted into a long-term care facility, there was a lady who was at a similar stage of Alzheimer's with her. The two of them would sit together and babble nonsense syllables at one another for hours, but their eyes were sparkling, their faces were glowing, they would periodically burst out laughing. They were spiritually connected, heart to heart. Who knows, maybe even they understood what one another was saying. Let's talk for a little bit more about forgiveness and how to help our clients walk through that process of forgiveness, again, on their timetable as they are willing and ready. For that client of faith, it's both a vertical process between themselves and their God, and of course, forgiveness is also often a horizontal process as well. It is simple, but it's not easy. First of all, the one-size-fits-all blanket absolution, I forgive you right now for anything you've ever done and ever will do, that is not very helpful, but specificity is. So as the client indicates a desire to forgive, it helps to have them specifically identify the hurt, the wound, or the offense, and who the offender was. So questions who or what has hurt or offended you? What have you lost? Tell me more about this. How have you been affected? Then we want to ask that person what their thoughts are about the situation and the person involved. What are their feelings? Sometimes they may be so shut down, they may say things like, well, I feel like they shouldn't have done that. That's not actually a feeling, that's a thought. So we may need to prime the pump a little bit. Sad, angry, abandoned, rejected, ugly, despised, stupid. These are all feelings, and we may need to even provide them a sheet of feelings and have them begin to list them, because they may not be aware of what they are feeling. Then, what was their role in the issue or issues? Um, Sometimes people will want to assume false guilt for, let's say they were abused as a child, and they may say, well, I probably did something to to deserve that. Nothing could be further than the truth. But if their role simply is, I've hated them ever since, then their role is unforgiveness, and that is something that they can control. What do they wish would have happened or not happened? And here's an area where we can give them permission to begin to hope and to dream again. We can ask them, if it could be any way that you wanted it to be, what would you like to see? This gives them permission to hope and to dream, and oftentimes brings them face to face with the reality of exactly how much they have lost. Then the next step may be giving thanks. And at this, many people will say, you have got to be kidding me. No way am I ever going to be thankful for being shot or being raped or being abused as a child or enduring horrible neglect. We're not so much talking about, oh, gee, thanks God, I'm so glad this happened to me. No, that's not it. It is more a humble acknowledgement that though this was a horrible situation, and God and any moral person would agree that it never should have happened, that it wasn't fair, that I am going to choose to humble myself and trust that God is big enough to bring something out of the ashes, and that I am a different person, I am a changed person because of this circumstance, and I have the opportunity then to explore what that means. So it's not so much giving thanks for as just acknowledging there are some things that I was not able to control, but I can use this to benefit myself and others, and good can come of that. That is an amazing thought when we stop to think about it. Then notice that we've done 6 steps here and not even talked about forgiving yet. This is because we want to give that person time to look at exactly what it is that they are choosing to forgive. And then only after they have had a time to thoroughly examine this can we invite that person to cancel this debt out loud and say, I choose to cancel this debt of retribution, of restoration, of that apology, of making it right. I choose to cancel this debt. The client may ask us, well, do I have to tell the person who hurt me? You know what? This may not be wise. Forgiveness is primarily a vertical interchange between that individual and God. It may not be wise. It may not be good for the relationship. That individual, if they are unrepentant for the wounds and the injury that they've caused me, it may not be wise for me to trust them by even going to them and being in the same room with them. That person may be dead that I've chosen to forgive. Stop and think about it. If there was a friend who betrayed you, or maybe that friendship is just not the same for some reason, it may not be helpful to the friendship to say, I've always hated you, but I want you to know that I forgive you now. Is that going to be helpful to the relationship? Probably not. So it is important to cancel the debt out loud. It may or may not be appropriate or even wise to go to the individual that hurt your client and have any dealings with them at all. This in itself can be a tremendous relief for that individual who thought for years, well, if I forgive them, I'm going to have to go to them and talk to them. Now, that may be appropriate and they may feel led to do that, but it's not necessary in order to extend forgiveness. And then release the offender and be free. You'll be surprised how good it will feel. For the person if your client is a person of faith, we may even say, would you be able to pray and ask God to bless them? Remember that historically God's blessing also includes God's correction and an awareness of wrong. So blessing is not just, oh, I'm so glad they hurt me. Let's hope they win the lottery too. But no, Lord, would you bless them and cause them to be the best person they can be? That will be a blessing indeed. Let's talk about the intervention of prayer now. What is prayer anyway, and can we even do that with a resident or a client? Is prayer primarily a dialogue, or is it a monologue? For many people, they find, even if they've been involved in an organized religious faith for years, that prayer sort of seems more like a monologue, where they're shooting thoughts and requests and complaints up into the atmosphere, but is anybody up there listening? But prayer, by definition, should involve dialogue. It is simply communicating with God. So the basic definition then, if I'm communicating with God, that means I'm talking with and I'm listening to. For our clients that we intersect throughout our day, prayer can take many different forms. It can be silent prayer, just within our own mind, or it can be out loud. It can be verbal, spoken prayer, or it can be written, or we can read prayers that are already written. It may be a solitary event, but for some of our clients, prayer is best serves their spiritual needs when it's done in a public traditional setting that they are comfortable with. It may be formal or liturgical. It may have a prescribed order and specific words that are used, or it may be informal. I remember one time at a critical point in my life just simply saying to God, God, I'm a mess, but I'm your mess. So it may be as formal as a part of liturgical worship, or it may be an informal cry for help. The position of prayer can be important. Perhaps for that client of faith, they feel more comfortable praying when they're standing, sitting, kneeling. For some, maybe even prone, maybe even laying face down on the floor before God. For some, it may be inside. It may be may take place only in a house of worship. For others, they feel most connected and most able to pray when they are outdoors. Some avenues of prayer that are maybe a little less commonly thought of are the idea of using art or music or dance to pray. Prayer at its simplest, when we're talking and we're spending time with a friend, what are we? We are giving them all of our attention. We are interacting with them in a way that's pleasurable and enjoyable to us. And prayer is that. There was an Olympic runner many years ago, back in the 1800s, and his story was told in the movie Chariots of Fire. He was a magnificent runner, and his faith was also very important to him. And one of the lines that so captures the essence of communicating with God, he said, God made me fast, and I feel his pleasure in my life most acutely when I am running. And so for some of our clients, expressing themselves through art, or getting lost in a beautiful piece of music, or even dance, even theater. I had a student one time who said, I feel most connected to God when I am up on the stage and I'm performing a part and I'm doing a great job. So prayer can take many, many different avenues for our clients. Let's suppose that a client, we've identified they're in spiritual distress. We have taken some time to ask them some of those door opening questions, and we have really established a connection with them. And let's say that they ask us to pray with them or to pray for them. Is that really all right? Will the prayer police burst through the door and haul us away if we do that? No, they won't. But it's going to be very, very important to remember our goals and to remember those spiritual ditches. Remember that we want to leave that client in the driver's seat, and we want them to be having that communication with God, if at all possible. Suppose a client asks you, well, why do you suppose God let this happen? Or what do you think happens when a person dies? Realize that if this client is saying these things to you, you have been handed a tremendous compliment. Remember that we may not communicate these things with our parents, with our friends, that politics and religion, these are not just casual questions. And so you have been handed a tremendous compliment. But we still want to leave that client in the driver's seat of meeting their own spiritual needs. So I may say something to that client like, well, that is a huge question. What are your thoughts about why bad things happen to good people? Why do you suppose that is? If they're a client of a specific faith, I may even ask them, what does your Bible say about that? What does the Quran say about that? I may want to encourage them to go back to those documents of their faith, and because I want them to answer the question for themselves. It is, after all, their spirit that we're talking about. But let's suppose that they answer those questions and then they turn back and say, okay, but what do you think? Again, to avoid the ditches, a light touch on the steering wheel is really necessary. And so I may say something to that client like, it's been my experience that, or my faith informs me that. And then I'm simply going to go on from there. I'm not going to press them to agree with me. And as more questions come up, again, I'm going to turn those questions back to them because I want them to get their answers for themselves. If that person asks us to pray with them, ideally we want them to pray. So we might ask, well, what concerns you most? What would you like to say to God? Let's say, for instance, they're having an MRI tomorrow and they say, I'm just scared to death. I hope and pray that it shows the cancer's gone. Would you pray with me? So I might take just those words and I might feed it back to them, and it says, and it sounds like you would like for God to help you get through that MRI tomorrow, and that the test results would be no cancer. Am I hearing you right? Yes, you are. Well then, I'm wondering, while I'm here, could you just say that to God? And so I'm going to encourage that client to pray to God themselves in their own words, their own conversation with me as a silent participant. But what if they insist, no, the good man and I upstairs, we've not been on speaking terms for a while. I want you to pray. Can I? Yes, they are asking for an intervention and they are asking me to provide it. But what if I'm not the same flavor they are? What if they're Baptist and I'm Catholic? Or what if they're Muslim and I'm Methodist? How on earth does that work? We take the same questions that we asked a moment ago and we simply pray what they say. So we may say something like, Dear God, Mrs. Smith that she's worried about this test tomorrow. Lord, I pray that you would give her, relieve her anxiety about that. And God, we really want good test results, no cancer. Amen. The client has identified the need. They've identified the specifics of what concerns them most, and they have asked us to do something about it. What if I don't want to? Or what if I just can't? First of all, let me reassure you as a nurse and as a healthcare provider. It would never be my desire that you be anything other than what you are. So always be yourself. I've had students say, well, I don't even believe in God or know if there is one. You telling me I've got to pray with a person? Absolutely not. But remember their community and be the next link in the chain. I might say something like, I'm just not the right person to do that, or I'm just not comfortable doing that, but I can see it's very important to you. Who else can we have come and pray with you? And so I'm going to refer again. I don't have to be all things to all people, and it really is not doing that person any favors for me to be the one-stop shop, the answer for everything. So I may just simply want to be the next link in the chain. What if I really want to, but I'm just too shy to offer that intervention? If you are a person of faith yourself, you can cover your day in prayer without saying a word. As you're bringing a meal tray in, you can ask God to bless that food and to help it nourish and repair their body. And with some hospital food, it may need all the prayer it can get. If I'm an OR nurse, I may be praying over each and every instrument and over the surgeon's hands silently in my head without saying a word, and asking that everything that's done in that operating suite be done to restore life and wholeness to that person. If I'm hanging a medication, I may pray that that medication does exactly what it's supposed to do with minimal side effects. And so it's possible to literally cover every step of your day in prayer without saying a word. And someone might say, well, you can't prove to me that makes any difference. And my response would be, well, you can't prove that it doesn't. So again, the spiritual world is mysterious, it's timeless, and it's invisible, but it is profound. So remember that prayer is a tool that you can use either with that resident, for that resident, or in their behalf without saying a word. So, which one of these tools might work in your setting? If you're a first responder or work in ER, ICU, you don't have much time. In the physical realm, your immediate goals are to stop the bleeding, stabilize them, and transport them. So in the spiritual realm, it's perhaps the same way. So interventions are going to be quick and short, but they may be very profound for that person. So the intervention of saying what you see, door opening questions, listening, silent or verbal prayer if they ask it, and again referring them. If they seem spiritually distraught as I'm doing the handoff in the ER, that's an observation that I want to pass on. Again, you're a link in the chain. We don't have to have the whole answer for everyone. In a hospital setting, in a long-term care setting, if your client contact is a one-time event or it's sporadic, you may only have time to use some of the interventions suggested for first responders. For clients that you have more regular contact with or for long-term care, you do have more time available to utilize the other interventions as well. And be creative as you think about incorporating some of these interventions, especially the idea of ritual. I already mentioned the dietitian who simply had a meal of a spoonful of ice cream with his client every day, and what comfort that brought to her. I have a nurse I've known for many years. Her name is Karen, and she's worked the night shift most of her career, which spans 20 or more years now. And she had one client in this nursing home that she worked with that every night when she would come in to help the client turn, Karen would always be singing little silly songs. Gradually, as she built relationship with that resident, she discovered that resident had a few favorite hymns. So when Karen would come in to turn, she would take a moment and softly hum or sing one of that client's favorite hymns as she turned her. It was a little ritual that they both enjoyed every single night. One time Karen was having a hard time at home, and when she came in to turn the resident, she was distracted and forgot to sing. And about halfway through, as she was getting her repositioned, this resident touched her hand and said, "Honey, you seem kind of down tonight. I'm missing my song." And as they both began to sing the song together, that spiritual care, that horizontal connection went both ways for my friend as well. Sometimes in the avenue of music, we may find that for older clients especially, they may love and enjoy the great hymns of the faith, but don't be afraid to branch out a little bit. There was a Sunday that I'll never forget. I had been taking a group of junior high and high school students into a nursing home once a month for about a year, and we would do a Sunday service for the residents. There were three ladies in particular, all in their 90s, all in the last stages of Alzheimer's, very flat affect, no eye contact, unresponsive. They sat hunched down and drooling in their high-backed wheelchairs. We had done the traditional hymns, and then for some reason one of my students had brought a tape of reggae music. And this student had also brought some very small little colorful banners that were on dowel rods that could fit easily inside of these residents' contracted hands. So we slipped the banners into the hands of these three ladies, and I had my doubts, but when that student hit the tape recorder button, and that tells you how long ago it was, and that reggae music started to play and the steel drums started to play, and the chant was about the joy of the Lord is my strength, to our astonishment and to the astonishment of everyone in the room, these three ladies sat up straight, their eyes grew wide and an expression of wonder on their faces, and they slowly began to rock back and forth in time to the music. Other residents noticed it, and they began to clap in time to the music, and it was truly one of those moments where heaven intersected earth, and we were all having a profound spiritual experience together. And so don't be afraid to step outside of the box and to try other interventions as well. We might encourage our client that we have more long-term relationship with to begin to establish a blessing box or a blessing journal. And perhaps at the end of our shift, we stop in with them and we'll say, what was a highlight today? Not, oh, let's minimize what was wrong and let's just, it's more than a cliche, but Mr. Jones, what was a highlight today for you? And then maybe we'll write that down on a slip of paper and tuck that into that blessing box. Then when the nights are long and or they're feeling down and distressed, maybe they can open that blessing box, or we can open it with them and read some of the day in, day out areas where their life has been touched with grace. Maybe it was a conversation, maybe it was a good meal around the table, maybe it was a funny TV program or an old movie that brought back great memories, maybe it was a visit with a family or a phone call. But let's begin to give them a tangible touchstone that they can access anytime. Perhaps maybe we are meeting a person on a regular basis in a clinic setting, and they are really wondering, what they're going to do with their life. Maybe they've had some setbacks in their job or in their education, and they are very discouraged. We might encourage that client to write down a mission statement for their life. If they had to say who they want to be at the end of the day in one or two sentences, who would that person be? The wonderful advantage about writing down a mission statement is that it gives us a filter for how we can then live our life. If their goal is to play golf like Tiger Woods, but they're spending 8 hours a day on the tennis court, either the goal or how they spend their time needs to make some adjustments somewhere along the way. And then we may encourage them to review that goal annually. Oftentimes, depending on our situation in life and where we are, whether it's a student, a young parent, a middle-aged adult, or an elderly person, our priorities may change over time. It's okay if our mission statement does too, but this is a very simple and practical intervention, especially if and as we have regular contact with our clients. So at the end of the day, there are some real benefits from addressing spiritual issues. We often think of hope and faith as kind of spineless, fluffy words. Hope we use often to mean, oh gosh, I wish, I have this vague hope that things will turn out okay. One of an old CNA student's manual defines faith as something that can't be proven. Well, that doesn't help me very much, does it? Again, more than one thing can be true. I can't plate faith out on a petri dish, but I can't do that with gravity or electricity either. Just because it's invisible does not mean it cannot be proven in that person's life. Here are some definitions that perhaps have a little bit more muscle in them. When we think about restoring hope, that word hope is a muscular word. It means to desire with the expectation of obtaining, to cherish a desire, or to trust. Faith is a firm belief in what another states, testifies, or affirms as true, simply on the grounds of their trustworthiness. Faith can also be defined as a practical dependence on a person, a thing, or a statement as trustworthy, something you can build your life on. When we talked about our just the way our culture bombards us with success and what a good life looks like, what we have to look like, how much money we have to make, whether we're physically active, all of those things are fine. And there's nothing wrong with looking good. There's nothing wrong with earning a living. There's nothing wrong with having a great education or driving a great car. But what about when you can't anymore? Or what about when your client never has been able to? Then they oftentimes feel like their life is of no value at all. That word value means the real worth, the proper price. I remember one time going to an event to honor the contributions of elderly in society, and I couldn't help but notice that though it was a wonderful ceremony, all of the focus was on the things that these individuals had done in their past. They had been a businessman in the community, or they had built a college, or they had raised children who were doctors and teachers. But these individuals were now unable to communicate. Perhaps they were sitting in a wheelchair with the catheter bag. Perhaps they were drooling. Perhaps they had lost their memory or the use of one side or the other. And so you can see how it would be very easy for that person to think, that's who I was, but what value am I now? It's helpful to think in terms of giving your client an idea of their true worth and their true value. You know, gold is worth so much an ounce, whether it's a filling in my tooth, whether it's a strand of gold wire in a computer chip, or whether it is a block of gold, or whether it's Queen Elizabeth's crown. Gold is still valuable simply because someone has decided that it is. I know when my mom was in the final stages of Alzheimer's, she could no longer recognize me. When I looked into her eyes, I didn't see any spark of recognition there. She did not interact with her environment at all. Not able to eat, not able to speak, not able to care for herself, not able to swallow. And what do we say oftentimes in the medical community when someone is not able to interact with their environment? We have a term for that, don't we? We may refer to it as a consistent or persistent vegetative state. And I understand that that is a technical medical term to describe a neurological fact. But we need to be aware of how such statements may devalue our person. When my mom no longer recognized me, no longer could interact with me at all, never at any point in time did I walk into the room, pull back the curtain to her bed, and find a piece of broccoli there or a carrot. She was always my mom. Alzheimer's had robbed her of her ability to interact with me on that psychosocial level. But I always knew, even when she could not speak to me, that I was in the heart of her downtown. And so even when she could not speak, a lot of times I would whisper in her ear, because she was a woman of great faith, and I would ask her to pray for different specific things that were going on in our family. And you know what? A person may say, well, obviously she can't, she has no ability to comprehend that. There's no intellect, there's no mind there left. She's a vegetable. I would say, prove it. I am as convinced of anything that my mom was praying, because remember that spirit is eternal. So as we take the time to provide these interventions for our clients or our residents, we are imparting something of value to them. We are saying, you are valuable right now, today, to me, and I am so glad to be doing life with you. As we do this, we will find that our clients derive a source of comfort, strength, and joy from us. We will also find that we derive the same from them. As we wind down to a close here in looking at providing spiritual care for our clients, I want to leave you with a story by way of a final thought. I hope you'll take the time to study this photograph very deeply as I tell you this story. This young man, his name is Chris, he had been on a trip to India as a young man, and his heart was captured by the beauty of that land, but also broken by the devastation, the poverty, the hard lives that people live there, and with the kind of the impetuousness of youth, he went to India and began to care for abandoned children. The little girl that he's holding was abandoned. Chris and the 2 or 3 friends that were with him had found her on a garbage heap. She She was actually about 6 months old at this time, and she was HIV positive. She was dying of AIDS. As you can see, as they're looking at each other, this is a moment of profound connection. Stop and think about what we said about spirituality. That it is first and foremost all about relationship. Chris and Prima don't speak the same language. Prima, by the way, is the name that they gave her, that they gave this little girl, and it means life. It means blessing. So Chris and Prima couldn't communicate between their different cultures and obviously their age. There was no verbal communication that could take place. There was very little physically that could be done for Prima. She died not long after this picture was taken. So in terms of caring for her, it was only the most basic of things that could be done. Bathing her. She couldn't tolerate food, but just lotioning her, changing her little tiny diapers and keeping her comfortably. And above all, holding her and loving her. There is a verse in the New Testament where one of the writers of many of the letters of the New Testament talked about doing everything that we do as if we were doing it in the sight and presence of God. As you look at the wonder and the love on Chris's face, and the peace and the wonder and the love on baby Prima's face, we can see that they are both having a profound spiritual encounter without a word being spoken. And we will find this true oftentimes for ourselves as well. I know from time to time in doing clinical with my students that occasionally we will care for a resident in a long-term care facility who is dying. And without exception, these are the most profound moments of the students that I've taught over the years. Without exception, they will describe this as a life-changing moment. And again, there's nothing much to be done but to give that individual the gift of caring and the present of our presence. So as you continue your spiritual journey, as you continue and perhaps explore ways of providing spiritual care for the clients and residents that you interact with, remember that this process of spiritual wholeness is just that. It's a journey. It's a process. It's not a one-time event. So join with your clients and embrace the journey. And thank you for doing this journey with me today.